So one of the impacts of the aging face, as well as probably the older surgeries we were doing for restoration of the periorbital tissues or the upper and lower eyelids, is loss of volume. Our procedures previously had taken out volume in the eyelids, which include the fat and the muscle. Unfortunately today we still see that occurring, even though we're teaching doctors to try to avoid this. We also see loss of volume as the result of aging. If we look at this top picture, you can appreciate that the upper eyelid is hollow and the lower eyelid is hollow. And this is a combination of surgery as well as loss of volume with aging. We have restored this in the office with the simple injection of hyaluronic acid. In this instance I used Restylane, and I do this with a cannula so that we're not sticking sharp needles around the eye, which avoids bruising, avoids pain and discomfort, as also avoids the risk of injecting it into vessels, which can cause complications. And you can see by restoring this volume what a nice appearance that it creates. And you can appreciate on the opposite eye, there's the hollowness of the upper eyelid, there's the emptiness of the lower eyelids. Restoration of that volume almost looks like she had a brow lift. Nothing was done to the brow, nothing was done to the eye. Simple injection into this area from previous over-resection of fat done elsewhere. See the improvement in the lower eyelids with the resolution of this dark circle from the previous over-resection of the fat.